Introduction. Your smile might tell more about your future bone health than you think. As bones weaken silently over the years, often the first visible signs emerge, not in your hip or wrist, but right in your mouth. Welcome to Thrive Sphere, where we explore how dental clues, often overlooked by both patients and dentists, can signal early-stage osteoporosis before fractures or X-rays ever show it. In this video, we'll cover right-pointing magnifying glass, the surprising connection between your mouth and your skeleton. White heavy checkmark, dental signs of underlying bone loss. Why early detection matters and how it can save your health. Real-world case studies and practical next steps. Hammer and wrench integrative strategies for bone and oral wellness. Chapter 1: The mouth-bone connection, why teeth reveal hidden osteoporosis. When we think about bone health, we often picture hips, spines, and wrists, but rarely our teeth. Yet your mouth may be one of the earliest, and most visible, places to reveal hidden bone loss. How bone loss affects oral tissues. As osteoporosis silently weakens bones throughout the body, the jawbone is no exception. The alveolar bone, the part of the jaw that anchors your teeth, can lose density, causing gum recession and thinning, exposing sensitive roots. Widening of the periodontal ligament space, making teeth feel loose. Shrinking bone height around the roots, increasing tooth mobility or even leading to tooth loss. These changes can happen gradually, often without pain, making them easy to overlook. The biological bridge. Your jaw undergoes the same bone remodeling process, osteoblasts building bone, osteoclasts breaking it down, as your spine and hips. If the balance tips toward bone loss in the jaw, it's a red flag that similar changes may be happening systemically. Routine dental X-rays, such as bite wings or panoramic images, can often show early mandibular bone loss years before a full-body DEXA scan would trigger concern. Bullseye: why it's important. What's happening in your mouth can serve as an early warning system for what's happening in your bones. Dentists are uniquely positioned to detect these changes early. Gum health and jawbone density can reflect silent systemic bone thinning long before a fracture occurs. Taking oral health seriously after 50 isn't just about saving teeth, it's a chance to save your bones. Your mouth might just be the window into your skeleton's future. Triangular flag on post. Chapter 2: 7 dental warning signs your bones may be weak. Your mouth doesn't lie. Often, it's the first place where bone loss quietly shows up, years before a hip fracture or vertebral collapse. These seemingly minor dental issues could be your body whispering a much larger message: your bones are weakening. 1. Tooth loosening without gum disease. If your teeth feel wobbly despite good dental hygiene and no signs of active gum disease, it may point to bone deterioration around the tooth roots. This is often due to loss of jawbone density, not just soft tissue issues. 2. Jawbone shrinkage on dental X-rays. Dentists can detect early signs of bone resorption using panoramic or bituing X-rays. A loss of trabecular bone patterns or thinning of the jaw's cortical layer is a subtle but crucial early indicator of systemic bone loss. 3. Receding gums with no obvious cause. While gum disease is a common culprit, unexplained gum recession may actually stem from alveolar bone resorption. As the bone underneath shrinks, gums lose their structural support and begin to pull away. 4. Frequent tooth fractures or advanced wear. Weak bone mineral density can affect not just your jaw, but the mineral supply to teeth themselves. This can make them more brittle, prone to cracking, or wearing down quickly even with normal chewing. 5. Delayed or poor healing after tooth extraction. After a tooth is pulled, your body should start building new bone in the socket. If healing is unusually slow, it could signal impaired osteogenesis, an early marker of osteoporosis. 6. Increased sensitivity to pressure or biting. When the bone supporting the tooth becomes thin and porous, even gentle pressure may feel uncomfortable or unstable. This hypersensitivity is often dismissed, but may reflect underlying skeletal fragility. 7. Loose or poorly fitting dentures. If dentures that once fit snugly now slip or feel loose, don't just blame the appliance. It may be your jawbone changing shape or volume, another consequence of progressive bone loss. Stop sign: don't ignore these signs. They may not scream osteoporosis, but they whisper it, clearly and consistently. Your dentist could be your first line of defense against a future fracture. Chapter 3: What the research shows. Science continues to validate what many dental professionals have long suspected: the mouth can reveal early signs of systemic bone loss, well before a major fracture occurs. Bar chart: scientific evidence. Mandibular cortical index, MCI, and trabecular bone patterns visible on routine dental X-rays show a strong correlation with low spine and hip bone mineral density, BMD. A large-scale study published in the Journal of Osteoporosis found that dentists could identify individuals at risk for low BMD with up to 80% accuracy, just by analyzing oral radiographs. Additional research confirms that postmenopausal women with osteoporosis often have more severe periodontitis and measurable jawbone loss, independent of other health factors. Real-life case stories. A 62-year-old woman came in for a routine dental exam. Her panoramic X-ray revealed jawbone thinning, prompting her dentist to recommend a DEXA scan. The result? Early-stage osteoporosis. With timely intervention, dietary changes, supplements, and weight-bearing exercise, she prevented a potentially life-altering fracture. In another case, a patient with chronic gum recession and tooth mobility was referred for further testing. Her dentist's suspicion led to a diagnosis of osteopenia, allowing for earlier, bone-preserving care. White heavy checkmark: key takeaway. Your dentist isn't just looking for cavities, they may be your first line of defense against osteoporosis. When jawbone density changes show up in the dental chair, it's not just a dental issue, it could be a sign to check your skeletal health more broadly. A simple DEXA scan, prompted by routine dental imaging, can turn a future fracture into a preventable moment. Herb Chapter 4: Periodontal disease and bone loss, a two-way street. Periodontal, gum, disease is often viewed as a dental concern, but it's far more complex than bleeding gums or bad breath. It's a chronic inflammatory condition that not only damages the structures around your teeth but also has serious implications for your bones, especially as you age. What happens first? When gum tissues are persistently inflamed due to plaque, bacteria, or poor oral hygiene, the bone around the tooth roots begins to degrade, causing teeth to loosen. This local bone breakdown triggers the release of inflammatory cytokines, such as interleukin-6, Illinois-6, and tumor necrosis factor alpha, TNF. These pro-inflammatory molecules don't stay localized, they circulate systemically, where they disrupt the delicate balance of bone formation and resorption throughout the body. Right-pointing magnifying glass: the bigger picture. Research consistently shows a strong link between osteoporosis and periodontal disease, especially in postmenopausal women and older adults. Individuals with reduced bone density are more susceptible to gum infections, and those with advanced gum disease often exhibit accelerated loss of jawbone density. The jawbone, being metabolically active, is highly responsive to inflammatory stress, meaning active gum disease can hasten alveolar bone loss, increasing the risk of tooth loss and structural facial changes. The bone-oral health connection. This isn't just about flossing, it's about recognizing gum disease as a clinical sign of systemic bone weakness. Routine dental cleanings, early treatment of gingivitis, and anti-inflammatory oral care practices are essential, but they must be paired with nutritional, lifestyle, and medical support to protect bone integrity. Small blue diamond bottom line? Periodontal disease is more than a dental issue, it's a biological warning light. Treating it early not only protects your smile but may also help preserve your skeletal strength. Ignoring inflamed gums could mean missing the earliest signs of deeper bone trouble. Chapter 5: Women over 50, why the risk doubles. For women, bone health enters a critical phase after menopause. The hormonal shifts that occur, particularly the sharp drop in estrogen, don't just affect mood or skin elasticity. They directly impact how quickly your bones break down, including the bones in your face and jaw. And often, your dentist may be the first to notice subtle warning signs. Postmenopausal shifts. Estrogen plays a central role in bone remodeling by keeping osteoclasts, the cells that break down bone, in check. After menopause, lower estrogen levels mean osteoclasts become more active, tipping the balance toward bone loss. Gum tissues also become thinner, drier, and more sensitive, increasing susceptibility to periodontal inflammation and infection. The result? Faster jawbone resorption, which can present as tooth mobility, gum recession, or changes in how dentures or bridges fit. Bar chart X-ray insights from the dental chair. Panoramic dental X-rays, common in routine exams, can show vertical bone loss along the jaw, thinning of the mandibular cortical border, loss of trabecular bone pattern, a subtle but early sign of osteoporosis. Some dentists are now trained to recognize these signs and may recommend a DEXA bone scan, a move that could lead to early intervention long before a serious fracture occurs. Thinking face, did you know? 1 in 3 postmenopausal women have undiagnosed low bone density until they suffer a debilitating fracture. Yet, in many of these women, jawbone changes were already visible in their dental records years earlier, often dismissed as simple aging. Small blue diamond takeaway. If you're a woman over 50, your next dental checkup could reveal far more than cavities. Paying attention to subtle signs in your gums and jaw could help catch osteoporosis early, before bones break and life changes. Chapter 6: How dentists can help spot osteoporosis early. Most people don't realize that their dentist might be the first healthcare professional to notice signs of osteoporosis. With access to detailed imaging of the jaw and routine evaluations of oral health, dentists are uniquely positioned to catch early skeletal changes, sometimes years before a bone fracture occurs. Television diagnostic techniques dentists already use. Mandibular cortical width measurement. On panoramic X-rays, thinning of the jawbone's outer edge, cortex, is often a sign of systemic bone loss. Studies have linked a narrower mandibular cortex with lower hip and spine bone mineral density. Trabecular bone pattern assessment. The internal spongy bone, called trabecular bone, may appear more porous, sparse, or deteriorated in patients with undiagnosed osteoporosis. These subtle changes can be visible on routine radiographs during dental exams. Scales # clinical clues beyond imaging. Dentists may also notice unexplained tooth mobility not caused by periodontal disease, altered bite patterns or shifting teeth due to bone shrinkage, difficulty fitting crowns, bridges, or dentures, even when gums appear healthy. These issues often stem from changes in jawbone density, not just surface-level oral problems. Envelope # collaboration is key. Forward-thinking dental practices now refer patients for DEXA scans if jawbone changes are suspicious. Coordinate with general practitioners and endocrinologists to ensure full evaluation and treatment. Integrate bone health screenings into routine care for postmenopausal women or those with risk factors. Small blue diamond bottom line? Your dentist isn't just protecting your smile, they could be protecting your spine, hips, and long-term mobility. Routine dental visits may uncover silent signs of bone loss, offering a powerful opportunity for prevention and early care. Chapter 7: Action Plan: What you should do next. If your dentist has flagged potential warning signs, or you've started to notice subtle oral changes yourself, it's time to take proactive steps. Your teeth could be telling you that your bones need attention. Here's how to respond wisely and holistically. Globe showing America's 1. Request a bone density scan, DEXA. A dual-energy X-ray absorptiometry, DEXA, scan is the gold standard for detecting osteoporosis. Ask your primary care doctor if you are over 50, especially women post-menopause. Have a family history of fractures or osteoporosis. Show jawbone loss or other dental signs of bone weakening. Early detection can prevent major fractures and long-term disability. 2. Optimize nutrient intake. Bone and oral health are deeply connected through nutrition. Focus on calcium, dairy, leafy greens, almonds. Magnesium, pumpkin seeds, legumes, whole grains. Vitamin D3, sunlight, supplements. Vitamin K2, fermented foods, egg yolks, natto. Consider collagen peptides to support gum integrity and bone matrix quality. Flex biceps 3. Practice bone-healthy habits. Lifestyle matters just as much as nutrition. Do weight-bearing exercises like walking, stair climbing, or resistance training at least 3x per week. Avoid smoking, it accelerates bone and gum loss. Limit alcohol and sugar, which reduce calcium absorption and weaken connective tissue. Get sun exposure for natural vitamin D, 15 to 20 minutes day when possible. 4. Prioritize oral health. Strong gums help support strong bones. Protect them by brushing twice daily with a soft bristled brush and remineralizing toothpaste. Look for hydroxyapatite or fluoride. Flossing regularly to prevent gum inflammation. Scheduling routine cleanings and dental checkups every 6 months. Addressing gum bleeding or sensitivity early, before it progresses. 5. Monitor subtle symptoms. Keep track of small but important warning signs. Teeth becoming loose or shifting position. Receding gums despite good hygiene. Ill-fitting dentures or bridges that no longer sit right. Unexplained jaw discomfort or pressure sensitivity. These symptoms can precede major bone issues, don't ignore them. Small blue diamond final note. The earlier you act, the more control you have. Your teeth may be whispering what your bones are too silent to say. Listen, act, and protect your foundation for life. Conclusion: the smile that speaks volumes. Your teeth do more than chew, they speak volumes about your body's hidden condition. Osteoporosis is often silent until it's too late, but the signs may already be visible in your smile. By listening to your mouth, partnering with your dentist, and embracing prevention, you can build a future of strength, balance, and longevity. Rocket subscribe to Thrive Sphere for more insight-packed content on aging well, naturally. Your health journey starts with awareness, and today, that awareness begins in your smile.